Hi guys, how are you? I hope you are well. Today in this video, I will explain to you topic 9, which is immunity and disease. Firstly, uh, what's the meaning of pathogen? Pathogen are micro-living organisms that live on the body of the host and causes diseases to it. But this word on body of the host doesn't mean the pathogen must live on the host body. No, some pathogen live inside the body host and the other live inside the body of the host, but this word on body of host means this pathogen depend on the body host to feed. Next point, let's talk about the mechanism. The mechanism or pathogens cause disease by one of the following mechanisms. First mechanism, maybe some uh, pathogens produce harmful substances. These harmful substances called toxins, and these toxins considered as a waste product from this pathogen, but these toxins spread around the body, and as a result of spreading of these toxins around the host's body, it can damage tissues and organs, and some symptoms appears like fever, like rash, and this make a host's body or make hosts feel ill, like bacteria. Bacteria produce harmful substances. Uh, the second method, maybe this pathogen damaged the cells of hosts by living inside it and start to perform reproduction process, forming large colonies like some viruses. Maybe mechanism as a result of the immune where when the host detect the pathogen in a specific site and then directs more blood to this site of infection, which can cause swelling and fever. Then let's talk about some types of microorganisms. This type of microorganisms can act as pathogen, like first example, fungi like athlete's foot, ringworm, or maybe bacterium, prokaryotes like cholera, tuberculosis, tetanus, or maybe viruses like polio, virus, AIDS virus, influenza. The last type of microorganisms that can act as pathogen, protists. Protists like malaria, like dysentery. Pay attention please in this note. This note talk about the tuberculosis bacteria. Now, the most deaths worldwide due to this tuberculosis. Or tuberculosis, now infectious disease, can causes most deaths worldwide. This increasing or most death of worldwide by tuberculosis due to what? Due to the pooring controlling programs against this disease. So poor disease control program and resistance of antibiotics. This disease, tuberculosis, have the ability to resist the antibiotics. antibiotics. And this disease rapidly increase between the young adults. You must know that this age of young adults at risk from tuberculosis or TB bacteria. Next point, let's talk about the type of diseases. We have two types of diseases related to they transmitted or not. Types of diseases, two types: infectious diseases and non-infectious diseases. Firstly, let's talk about the infectious diseases. Infectious diseases means they are diseases can transmitted from an organism to another, and this disease is caused by pathogens. But the non-infectious diseases, they not transmitted from organs. Like what? Non-infectious. We can classify the non-infectious diseases into four categories. The first category is deficiency disease, like rickets and scurvy. Maybe the second category, inherited diseases like sickle cell anemia and diabetes. Maybe generative disease like COPD, and bronchitis. This generative infected the respiratory system. Let me show you the full name of COPD disease. C letter for word chronic, O for obstructive, P for pulmonary, D for disease. So COPD means chronic obstructive pulmonary disease. The other or the last type of non-infectious disease is cancer. Cancer resulting as the result of exposure to ultraviolet rays. Let's talk about the infectious disease and how this infectious disease spread. So let's talk about the methods of spread of disease. We have two methods. The first, contact, direct contact, and the second, indirect contact. In this video, we will talk about direct contact. Direct contact may be caused by touching, like athlete's foot. So be careful. Don't change your choose with your friend. Don't change your choose with your friend, and don't wear your friend's shoes. Okay? Second method of direct contact may be this disease pass from the pregnant woman to her unborn baby, maybe through placenta or maybe breastfeeding. And this is like HIV disease. Or maybe this disease pass through the body fluid in case of sexual intercourses, like AIDS, like hepatitis B, like syphilis. So in the next video, inshallah, we will talk about the indirect contact. Thank you.